crisis serving our nation. At Bouvé, we are committed to providing exceptional health care to every patient, every veteran, and this is particularly important for veterans who deserve nothing but the best care for their selfless service. Today, I'm thrilled to introduce a panel of Bouvé alumni right in front of us, who will share their expertise on advancing the health span of our veterans. It is our responsibility to ensure that our veterans receive the best possible care, as we said, and this panel of experts will provide invaluable insight into how we can achieve that goal. Without further ado, I am delighted to introduce Margarita Dibal, a distinguished alumna at Bouvé College of Health Sciences, and someone I have the pleasure to work with closely as she serves as the Senior Associate Dean for Faculty Affairs, Diversity, Equity, and Inclusion. Margarita is also a professor, a clinical professor in the School of Pharmacy and Pharmaceutical Sciences. Her outstanding experience and expertise in the healthcare field make her the ideal candidate to moderate this panel. So thank you, Margarita, and thank you all for being here.
Thank you so much, Carmen, and thank you to all of you for agreeing to be our panelists today. When Louis and I were talking about how can we profile our alumni through this Bouvé reunion, we talked about the fact that today is Veterans Day, and I know some of you in the audience and some of you here have been in active service, and I want to thank you for your service, and I want to thank all of you who take care of our veterans for your service as well. One of the interesting things I learned recently about VA is their whole health approach. And I thought this was also a great opportunity to highlight it because as if you were here earlier during the Bouvé Honors celebration, Carmen spoke a little bit and Louis spoke a little bit about the fact that the vision in the Bouvé in recent years under Carmen's leadership has really focused more on educating and preparing our students as well as engaging in research that can advance the health span of people. Not looking at people and not preparing students just to treat the disease, but how do we actually keep our patients healthy? And how do we involve them in the care and their own lifestyle to keep themselves as healthy as possible for as long as possible? And to me, there was such a great alignment with what I know about the whole health approach from the VA. And for those of you who are not really familiar with that, we do have a 2-minute video that I would like to share with you right now, and hopefully we can all see it together.
What matters to me?
That's a tough one.
I haven't thought about that since I served.
My doctor's never asked me that before.
I guess I'm looking for purpose.
To be more present.
To discover what matters.
Whole health is about treating you, the person.
It's a conversation with your doctor or a peer, talking about what you want out of your life.
We focus on what matters to you.
Not what's the matter with you. Instead, helping you reach goals like
being there for my kids.
Rediscovering my drive to compete.
Finding my center.
Giving back to my fellow veterans.
And I'm not doing it alone.
I've got a team.
I've got a plan.
I've got support.
What matters to you?
So before we start talking about whole health approach and what it means in practice, I wanted to take a few minutes to have you all introduce yourselves and tell us a little bit about what is your profession, when did you graduate, and how do you work with the veterans right now or in the past? We'll start with you, Mark. Thank you.
Test. My name is Mark Broker. I'm actually a 30-year Navy veteran. I graduated from Northeastern in 1980. my association right now with the VA, I get my care at the VA in San Diego. That's where I live. So I'm a patient, but I also coach VA medical center directors or the CEOs of VAs under a contract with my company that I started a few years ago. So I've heard about whole health, and I'm intimately involved with rolling it out. And I'm sure in the discussions here we'll talk about my specific role with that. But it's a beautiful initiative. Very cutting edge. In the Navy, we called it patient-centered care. It has different names, but it is all about what does the patient need, and not just treating the disease, as it was mentioned. So thrilled to be here. Thank you for inviting me, and looking forward to this discussion. Thank you.
Let's see, is this working? You can all hear me. Hi, everybody. My name is Laura Dudley, and I graduated from the master's program in applied behavior analysis here at Northeastern back in 1997. And I'm now a full-time faculty member here at Northeastern. I'm a core faculty member in that program. I did do about 20 years of clinical work before becoming full-time faculty here. And in my clinical work, I did educational and behavioral consultation, including behavioral and educational consultation to children and families, military, active, and reserve. And so I'm happy to be here and talk a little bit about what that experience was like and some of the important things to consider when working with families who are military and making sure that we are incorporating those children and families' desires and visions and goals into everything that we do as an educational team. I also wear a hat here at Northeastern as Director of Mindfulness Studies, and so we just saw in our video here the gentleman who was meditating, and so I'm also happy to talk a little bit more about mindfulness and mental health and the application of this to first responders, which is an area that I've been involved with as well as military. So thank you all for having me.
Hello, my name is Suzanne Molino. I graduated Northeastern College of Pharmacy in 2015, and I actually started my career at the VA here at West Roxbury as a co-op student. And I went on to train my first year of residency program at the VA in Ann Arbor, Michigan. And following my second year of residency, I joined faculty at Rosalind Franklin College of Pharmacy, which is right across the street from a very unique military facility at the Captain James A. Lovell Federal Healthcare Center. It's the only one like it in the nation. It's actually active duty military and veterans. So I had the honor of serving as a clinical pharmacist in a couple of the specialty clinics that I can talk about, cardiology, pulmonology, and then my real passion, HIV and infectious diseases for both active duty military, their dependents, as well as veterans, and conducted research and had students there as well. I'm no longer with the VA, but I certainly can say that my time there is some of the best time I've spent practicing. Thank you.
Okay, good afternoon, everybody. My name is Natalie Libro. I graduated from Northeastern's Doctor of Physical Therapy program in 2014. I spent about a year in inpatient rehab before I moved to Orlando, the VA over in Lake Nona, and was part of their ground-up team, so part of the initial outpatient clinic that developed there. I worked as a staff member, worked as a supervisor for a few years, and then the last 2 years I spent as a residency director, orthopedic residency director. I recently transferred to Connecticut, and my position now is specific to complex pain physical therapy. So I am completely in clinical care, but with a complex pain approach, excuse me. And I'm very happy to be here. And it's about 10 years now in the VA, almost 10 years. So definitely happy to talk about my experience overall in serving veterans and their families. Thank you.
All right, hi everyone. I am Jordan Goodman, and I graduated from Northeastern's doctorate in physical therapy in 2022, where I had a clinical rotation at the Cincinnati VA Medical Center in acute care and cardiopulmonary rehab, which is what I wanted to do. So I stayed for residency there as well, being their first resident and developing the program this past year, and then recently transitioned to the Boston VA as an acute care physical therapist with a big focus in intensive care and cardiopulmonary patients. So definitely agree and love the whole health model. That's what I preach to all of my patients. So I'm really happy to be here. Thank you.
Good afternoon, everybody. My name is Brian Wood. I am a 2003 graduate of the School of Pharmacy, the first all PharmD year when there was the switch from BS to PharmD. Margarita was a first-year professor back then and guided me a lot of the way through my pharmacy school. I currently am a clinical pharmacist practitioner and the PGY1 residency program director for the pharmacy residency program here at the VA in Boston. So that includes the Jamaica Plain, Brockton, and West Roxbury campuses. As a CPP, I've had a lot of different roles, mostly in ambulatory care. I'm currently working 2 days per week in anticoagulation clinic, and then the other time is spent doing the residency program. The director of the program that started the year that I did my residency in 2003 to 2004 decided to step down in 2016, and so I've been the director of the program since. Happy Veterans Day to any veterans that are out there, and thank you for coming today.
Wonderful. So it's clear that you represent very different disciplines, and you represent sort of the diversity of experiences from the ambulatory care to, you know, being more at the corporate sort of level of overseeing an organization and implementing programs. And you're also a patient. So it's wonderful to hear different perspectives today. I also noted that, as Laura was talking about, you know, when we approach veterans, we don't just approach people who have served and have, you know, different and similar kinds of health issues as the rest of the country, but also their families. And certainly we know that they have higher rates of mental health, PTSD, other kinds of issues that they deal with, as well as potentially, you know, injuries that are, you know, more disabling or debilitating, I guess. And so I think it is important to approach the care of patients like that, people like that, not just as a whole person, but also as a whole family unit potentially. So with this, I would love to learn more about your role or how this whole health approach has really changed the way you've done things sort of over the years, and what you're seeing in practice. Mark, maybe we'll start with you because you're experiencing this as a patient, but you're also implementing it from sort of
I get both sides of it.
Yes.
Well, you know, I think it's important to just talk about the whole health concept. At the end of the day, the people who join the military, volunteer to join. Glenn, I got to talk to Glenn, who went in the Army many years ago. I talked to Jen, whose daughter Alexa decided to join the Marines, which surprised her a little bit as a young 18-year-old. The point is, it's an all-volunteer force. And if you read the newspapers, it's a very dangerous world. The likelihood of us getting in a real war, I think, is, I have no intel more than anyone else does in this room, but it's a very dangerous world. And these men and women who they signed up, especially today, they're not blind. They know what they're getting themselves into. My son's an F-18 pilot down in Oceania, and I worry a great deal about the world as we have right now. So what does that have to do with whole health? Actually, a lot. When I came in many years ago in the military, and Glenn, I don't know your decision to go to West Point, or Alexa's decision to join the Marines, or my son's decision to go down the path to you know, to be at the tip of the spear in an F-18. But part of it, I'm sure, was, okay, I'm going to get paid. That's a good thing. I might get a retirement. That's a good thing. But maybe at the end, maybe I'll get decent health care. And the VA, and I do a lot of coaching of corporate CEOs of hospitals affiliated with major universities, whatnot, but the VA, in my humble opinion, is at the forefront of tremendous health care. The difference between the VA and a corporate is the VA airs their dirty laundry because they must. They have their board of directors as Congress, which is an interesting concept. But the same stuff is happening, not such good news stories or in other healthcare organizations, but the VA is a tremendous organization. And this whole health concept is still, it's new, it's going to take a while to get there, but it's, like you said, it's about taking care of the patient, not just the disease, trying to understand, walk in their shoes, what is the issue that I can help you with today, the number of social workers and the army of people that the VA brings to the table that can really implement this. The Navy went and I think the Army did the same thing, patient-centered care is a good concept, they're still working at it, but they don't have, I think, the level of professional help that the VA has. So I think this is an extremely important initiative because at the end of the day, people join the military, it's a volunteer force, and part of that calculus of whether to join or not is, am I going to be taken care of if I get hurt, if I get injured, from the battlefield to, to the end of my life, and the VA does a tremendous job of that. And I think this whole health frankly, it's important to our national defense. We've got to have a healthcare system that will take care of the veteran. So, I'll leave it at that. That probably took too much time. Let's hear more from our colleagues. Thank you.
In the last 20 years since I started residency, this has been coming, and I think it's been packaged in a few different ways. But for it to be branded as whole health, it means whole health. It's everything. I mean, the panel is made up of physical therapists, pharmacists, a veteran here. We have a great interest in everything, and that actually comes down to even what I do. If I'm treating a patient for diabetes, or as we move into other disease states, COPD, CHF, whatever it is that we're treating them for, medications can only do so much. I think that even as a pharmacist, I sometimes think that there are too many medications just thrown at patients hoping that that's going to fix the problem, and it doesn't. So when you have, for example, mindfulness exercises, when you have a physical therapy program that is focused on your pain care, that helps, I think, for patients to understand this isn't just about going to your primary care doctor. This isn't just about going to the specialist in cardiology. This is about everybody being there for the veterans. It's definitely a team approach. Just in primary care, starting probably maybe 10 years ago, it's called it's called PACT, which is the Patient Aligned Care Team. So basically, you are at the center of the wheel, and all of the specialists that could possibly help you rotate around. Sometimes some people may step out of the circle, and other practitioners step in, but it's important, I think, that we, as the providers of care at the VA, understand that they're not coming just to see us. We can't necessarily take care of everything that the veteran needs. It needs to be a team-centered approach. And so I think that with this having been coming since I was in the VA, and probably a little bit before, and it's been named different things, now the whole health initiative is pushing forward. You saw the video, and I mean, that was a very brief snippet of it. I think when you step into the VA as a patient or as a family member or a caregiver, you see that it is all about the veteran. It is all about exactly what is wrong with the veteran, everything, not just one particular thing, because no veteran comes in with just one disease state or just one issue that they need to address. And I think that you can feel that, certainly when you walk into the VA in Boston.
Wonderful, thank you. Yeah, thank you. Go ahead.
Sure, and great segue actually into a lot of work that I do. So in PT school, we learn a lot about the whole health model, but they don't actually describe it as a whole health model. It's just interesting to see coming out of school and practicing that what they're teaching is what I get to do every day. And with my work in cardiovascular and pulmonary physical therapy, I see patients across the spectrum. So I'll see them starting in the intensive care unit. Oftentimes they are on a ventilator or do have a left ventricular assist device or something along those lines. And we start that whole health approach there. It's not just physical therapy. it's not just the doctors. We started there, and then I transition them throughout their care. So going from the inpatient acute care hospital setting to wherever that discharge plan is, to hopefully outpatient cardiopulmonary rehab or cardiopulmonary physical therapy. I've worked up a lot of patients for heart and lung transplants. I've had a lot of patients with new hearts and lungs. And through this process of how you get a set of lungs, if you're so lucky to get one, or how you get a new heart, is the whole health approach. So you have to be worked up by social work, psychology, the pharmacists, the physical therapists, the occupational therapists, the doctors. So everyone's working you up, making sure that you have the capacity and you understand the gravity of getting a new life. And so I think that continues throughout, even outpatient cardiopulmonary rehab, is asking patients about their diabetes and making sure they are not experiencing any food insecurity. So we really have the ability to do a lot of things for our veterans and making sure that we're addressing all those things. So it's a really rewarding experience to be able to do that.
Do you want to add, Natalie?
Yeah, just taking it a little bit further. In school, we always spent some time learning about the differences between multidisciplinary and interdisciplinary. And I think when I first got out, there was a lot of multidisciplinary type of care taking place. And while it may have felt like a whole health approach, it really wasn't. So being able to be part of the developing clinicians here that can kind of see that through, and the VA is really pushing it interdisciplinary. So on a regular basis, I'm communicating with psychologists, I'm communicating with the primary care, I'm communicating with OT, I'm communicating with sometimes just the caregiver. So we learned about it, but I feel like it wasn't really put into action until within the last 5, maybe 10 years or so. So it's been nice to be part of that growth, but really multidisciplinary versus interdisciplinary is the biggest thing for me.
Thank you. Suzanne, do you want to add anything?
The only thing that I would add is that the only thing I would add is that, I know a lot of you all have worked in the VA for a very long time. I had the pleasure of working there as a young clinician, and it was the first experience I had out of residency. And I most recently, after that, worked in a low-income community in Brooklyn. And there was such a big disparity of what vets were able to get versus other lay folks were able to get. For example, heart failure. I worked in heart failure clinics in both of these settings, and the wonderful thing that you almost don't even realize when you've only ever worked in the VA are all those other supportive things, like a scale, at-home telemonitoring, sending an actual technician to a veteran's house who's going to set up a scale and a blood pressure cuff that's going to actually send those results to the doctor, because that veteran lives 100 miles away, in order to create that sort of care for the patient. Working in low-income communities outside of the VA, some patients don't have $30 to spend on a blood pressure cuff. Never mind learn how to use it correctly and make sure that they're using it correctly. So those sorts of services for the whole health approach, it's not just, oh, come in and get your prescription, I hope you don't get hospitalized. They're sending folks to the home. There's actually something called home-based primary care, where that entire packed model, every day of the week, folks are going to the veteran's home if they're unable to leave it. I mean, that's a pretty remarkable service. Those are the things I almost wish were more in the news, right? Those are the things that the VA should be in the news for. Because a lot of times what's in the news is if there's one misstep, because who's in charge is Congress, right? But what should be in the news is the people who get this extraordinary level of care because it exists, and the VA is just a very, very special place to work.
Thank you so much for sharing that. Yes, I agree. Health equity is something that we often talk about here, and we also talk about access to care, which is becoming more and more limited because of the shortage of the workforce, but also many people live in very rural communities where getting to a point of care is also quite a challenge. I want to ask Laura specifically to comment from your perspective about, again, how do some of these non-traditional things that we didn't learn about in school — I know I didn't learn anything about mindfulness or meditation when I graduated in '99, was my PharmD degree here, and also just maybe commenting on the family aspect of it and your experiences working with families.
Sure, I'd be happy to. And actually, our very first mindfulness class that we offered here at Northeastern was almost entirely made up of pharmacy students, and is now continues to be a very popular course among the pharmacists. And I think that they comment, just as you're saying, that of course, medication has its place and is so important. And maybe there are also some other sort of non-traditional sort of proactive approaches that we can take in the mindfulness or self-care space. And just thinking about the mental health space, Suzanne and I were talking before we began, and I was just so impressed and struck by some of the creative ways in which the VA was making sure that patients got the care that they needed. And so employing some sort of creative solutions to some of those problems. We know that we are in a mental health crisis in that we don't have enough providers to provide the mental health care and support that is needed, not just among veterans and military, but among the general population. And so I think we do need to continue to look at creative solutions to this crisis. And I think the VA has some really innovative and interesting ways that they are doing this. I also think that something that I became aware of more recently was that really it was the VA about 10 years ago that was interested in looking at the potential outcomes from mindfulness practices. And so they put together a report. They had researchers looking at all of the research that was out there on mindfulness, meditation, yoga. And what they found was that this very comprehensive report back in 2014, they found that the research was not very well conducted. And I think there was something like 8,000 studies that were looked at, and it was concluded that of those 8,000 studies, only 47 could we actually have confidence in. And the reason that I bring this up is that what happened after that is really a fire was lit under this body of research. And what we've seen over the last 9 to 10 years is much better research coming out in this space. And again, it was really driven by this report that was put out by the VA. And as you can see, the whole health approach includes this sort of self-care, proactive, sometimes includes mindfulness practices as an important component of the whole health model.
Great. Maybe a little bit more about the families.
Yes, no problem. So I can talk a little bit about, I had mentioned in my introduction, my work with families, and what I was working with mostly teachers and families on, in particular, there's an Air Force base nearby that I was providing this consultation on, and we really focused on the needs, the unique needs of the child and the family. And so I agree that there's this term of patient-centered healthcare is something that we hear a lot about, but I really do like this term whole health, because I do think that it reflects what we should be doing, which is considering the not just the child or the patient, but the entire family. And so to give an example of some of the work that we were doing, you know, an educational team might do an assessment of a student's needs. And so they might come back from that assessment and say, well, the child needs to, work on their letters or their reading or their writing. And what I think was being ignored in some of those instances was the family really wants to work on this child's ability to communicate and show, their emotions and play with their parents and things like that. That's what's important to the family. This was especially during a time when things were really uncertain about whether people were going to have to, no longer be nearby and maybe be have to leave at a moment's notice. And so it was really important to these families that they had connection with their children. They were not as concerned about reading and writing and letters as they were about those kinds of opportunities for connection, at least in the short term. So those were an example of the kinds of considerations that we would sometimes make, which was how do we make sure that we're meeting the needs of the family and the child, and not just going through sort of, your blueprint of an assessment and coming up with an educational plan that's not actually reflective of what the family's looking for.
Thank you so much. So you all talked about how maybe the practice and how we've prepared your students and what the practice was and some of the practice challenges and opportunities, how things are different over time and how sometimes we don't know really what the future will be or what we will think about and care about in the next 5, 10, 15, 20 years. So I would love, we have a lot of educators in the room. We have a lot of people who are program directors and deans. And we would love to hear more about what can we do more to prepare students, to inspire them to provide care to the veterans. And also, what kind of research opportunities and questions could we be focusing on more? Because we also have a lot of research, active faculty who do all sorts of research from Salsa Society. And so we'd love to hear more about from your perspective. And anybody can start.
If you happen to have time and you drive up past the Museum of Science, the MFA, to South Huntington Avenue where it curves and then the T ends, that's the Jamaica Plain VA. And right in front of you where the T ends is a brand new research building that was just opened last fall maybe, which the VA has always been very, very involved in research, but they're doing incredible studies looking at things like the effect of mindfulness, looking at things like the effect of physical therapy, occupational therapy, things like that. 20 years ago when I started, there weren't very many young veterans coming into the VA. The population was 50 plus and mostly 65 plus. And a lot of them were there because they either didn't have other health care or they did have, they were considered shared care where they had care in the community, but they were coming to the VA for specialty needs. It could have just been prescriptions, whatever it was. But now there is a huge, so to hear Laura talking what she's talking about, there is a huge population of much younger veterans that are coming in now, and it could be because of the crisis in mental health that we're facing. It could be because they've heard how great the care at the VA is. I'm not exactly sure, but VA care is for life. VA care is constantly changing and evolving. I would say for students coming through, just making them aware that there's more to the care of someone than just prescriptions. There's more to the care for some, you know, the approach has to be from all angles, everything that a veteran can do, because especially our 65 plus veteran population, they maybe don't have the energy or the time or the desire to be doing a faceted approach, which includes exercise and diet and medications and all of those things. But if we have practitioners coming into the VA, especially pharmacists that are able to discuss with them that it really is a whole health approach, it's not just about medications, it's not just about, you know, getting an x-ray and having a surgery on something. I think that's important because, you know, like some people were saying earlier, you hear about these things, but you don't necessarily see them everywhere. You're going to see it at the VA. You're absolutely going to see the whole health approach. And I think being able to work interdisciplinary and not just in an intradisciplinary way, inpatient, outpatient pharmacy, but to be working and comfortable with working with other healthcare providers. The pandemic kind of put a huge dent in the ability for medical teams, unless they were rounding in an inpatient setting, it made it very difficult because doors were closed, masks were on, people were working remotely. There wasn't the collegial and kind of group practice atmosphere for those couple of years, and I think we're just now coming back into it. So I think for anyone coming out, and whether they're going to work in the VA or not, it's just understanding that the more you foster those relationships between providers, and the more that you express how important it is to be on, you know, first name basis with those other providers, the better it's going to be for outcomes for the patients. And I think that's exactly what some of these studies are showing. So for any researchers in the room, I'll say that, you know, if you don't know about VA research, which I'm sure you probably do, it's an incredible avenue. It's an incredible place. One thing that I'll mention is the Million Veteran Program that's been going on for maybe 10 years, and it's gathering data and information so that they can then pass that on and improve the care yet again and publish those studies so that it can be applied more to the general population as well.
Thank you. Go ahead, Natalie.
I'm not sure if this is already being done, but maybe more simulation samples or exercises where it's multiple disciplines approaching a particular patient situation, and then being able to maybe discuss it and see how, you're a pharmacist, how would you approach this? And you're a physical therapist, what would you be looking at? I think more experiences like that, I think would really help a lot of the students coming straight out of the program, going directly into work, or new clinicians or so.
Definitely, we always discuss, we do have a sim center that, I don't know when it opened its doors, probably at the end of like maybe somewhere around 2016, 2017, and actually on our Charlotte's campus as well, where we have several programs. We have a great sim center there. We are always striving to increase interprofessional education and collaboration just among all of our schools. Challenges, of course, include like rigorous accreditation requirements from everybody, our schedules for our students. Having everybody in the same place and time is sometimes challenging, and I know that some of our faculty are very interested in VR and XR technology to simulate those kinds of situations. Listening to you all makes me think that how wonderful would it be for us to engage with our alumni to create and develop some of these cases that are very much inspired by real patients that you all work with, because certainly, for us, many of our clinical faculty continue to practice, and so they bring that experience into the classroom and into the experiential spaces like labs and sim center. But I think it's a great opportunity for us to engage with alumni. And if you, certainly for anybody who has time to give, I know that when our sim center runs simulation, they rely on many people who come in and they play. We have a standardized patient program, but we have people who come in and do evaluations and do debriefs, and in that kind of part-time capacity to help in terms of the numbers. And anybody who's here who has other things to say about this, because I know all of you are actually on the front lines of developing these programs and developing these cases, certainly speak up. I think we may have a microphone somewhere in the room. So I'll let our panelists, though, to continue this discussion. Thank you.
Well, can you hear me? There you go. At the end of the day, like any other initiative, whole health will succeed or fail based on the leaders within the VA. That's basically it. It's if you start an initiative, if the people trust you, they feel cared for, you do some basic things as leaders do, generally you can change things. If you have fear and people just are doing this for a paycheck, this will not succeed. So you mentioned there's leaders in the audience. I think, and I know Dean agrees, one area where there's always room for improvement in just the amount of time we spend on this thing, but creating leaders. There was a study done, we've talked about mental health issues, and obviously there's, I think the reason people are coming to VA, there's two reasons. One, it's the reputation is getting where it should be. It's a tremendous organization, but there's a fair amount of people who deployed in OIF and OEF, Iraq and Afghanistan, and they're traumatized. 20 years is a long time to go to war. Both men and women have been traumatized by that event. But there was a study done, it's a fascinating study, replicated in other areas, but this was done by the Pentagon, I think between 2008 2013, 150,000 of our men and women deployed in those battle zones, and they were concerned about resiliency. They were wondering, how do we build a more resilient soldier, sailor, airman, Marine? So I won't go into the intricacies of the study, but what they found out is this: they could, those soldiers who were led by poor leaders, 44% incidence of PTSD in that group, basically 4 in 10. Those who were led by good leaders, I think it was 7%, what is it, I don't know, 1 in 15, a significant decrease in the incidence of PTSD, and these men and women were all in battle because of the behaviors of the leader. So we do have a crisis in our country with mental health, and the data would strongly support that one way to combat that, if you in a certain way, is tremendous leadership. And it gets right back to the whole health. It will succeed or fail based on if the leaders, from Secretary Hall to everyone down, supports it. I know he does, but it's going to take the tactical leaders, the head of the pharmacy, the head of PT, the division, mid-level managers. Are they on board with this? Are they going to convince their people who've been doing it a certain way for 20 years we're going to look at a bigger picture? Can they convince them? Can they build that trust and show that they care? In those organizations throughout the country, those VAs that have that great leadership, they'll move ahead with whole health, and those who do not will not. So it really gets down to, everything else, it comes down to leadership. Anyway, yeah, thank you.
Yeah, I think that's a very important point. I do think we all try to empower students to become the next leaders, right? And in the workforce, and certainly you're right, change is difficult, and changing agents and leadership is really important. Very interesting to hear about this study and how it impacts people in the field. Very interesting. Any other thoughts about this? Go ahead, Jordan. There we go.
Okay, that works now. I think you have to teach it from the start. I mean, day one of the programs, whether it's pharmacy or nursing or physical therapy or whatever it is, you have to teach from the start about this interdisciplinary whole health approach. And I was recently at the National Cardiopulmonary Physical Therapy Conference where I was presenting my research from residency, and there was a great presentation about how are you leaving your outpatients out and incorporating that whole health approach for people that didn't actually work in the VA into practice when you're teaching. And their idea was, I mean, this is specifically to cardiopulmonary physical therapy, but is how, when you have an outpatient, a lot of physical therapists want to do outpatient. And how are you incorporating these other aspects of physical therapy into this outpatient practice when you're teaching? And we went through a lot of case studies there, and that was something that I did when I was in residency and teaching, was developing case studies based on actual patients that I saw and bringing it to the students and having them in a simulation treat the patient. I was the patient and they had to treat me. And we would debrief throughout and after and talk about, we had take breaks and timeouts of, okay, why are we doing this way? How are you thinking about this? Really developing that clinical reasoning. But we're doing that from the start, and I think that's really important.
So I'll also add that I've worked at a couple different colleges of pharmacy who all highlight and incorporate interprofessional education a little bit differently. The most intricate program that I worked at was Rosalind Franklin College of Pharmacy in North Chicago, and actually the pharmacist taught the PA students pharmacology. And I actually was the director of this interprofessional class where second-year PTs and third-year pharmacists were going through a kind of a mysterious diagnosis, what was going on, and the PAs were teaching the PharmDs about diagnostics. Then the PharmDs were teaching the PAs about how to choose the right medication. So it was really ingrained, but of course, as we know, curriculum committees are very busy because curriculum is very difficult to lay out in colleges of pharmacy, in any program really. So even just finding other ways to incorporate it at Long Island University, where I most recently taught, we would do cases where every discipline and a professor from each discipline, twice a quarter, were held. And it wasn't always just about patient cases. The most interesting one for me was ethics, medical ethics, which is not something that's commonly talked about. It was disclosing an HIV diagnosis to somebody admitted in the hospital. And it was really interesting based on what different students had learned, like how they would approach ethics, because typically medical ethics is only in medical schools. So, being able to incorporate something beyond just how to treat that patient was more of a whole health approach. How are you going to think about their mental health if you told them that they have a diagnosis? How are they going to be connected to care? How are you going to take care of that person as a whole? So I think finding creative ways, if the curriculum doesn't allow for a full course or year or two of interprofessional care, but finding other creative ways to bring those students together in sim labs or in maybe a student-run free clinic or in some other sort of setting. I think hands-on learning is always the most effective.
Wonderful. Thank you so much for sharing that. I wanted to ask if anybody in the audience has a question for our panelists. There is a microphone. Go ahead, Jean.
It's on? Great. Thank you for this great discussion, and again, thank you for your service to all the veterans here. I wanted to hear you comment about the VA programming and your approaches to the Healthspan aspect of care for the veterans, but you talked a lot about your approaches to the healthcare portion of things. When they come to the VA, they usually are, in need of critical services. But can you comment a little bit about what's happening on the Healthspan preventative side of the spectrum?
Great question.
So whenever someone comes into the VA, no matter whether they're there for something critical, emergent that they need taken care of right now, or they're just enrolling because they're going to need health care, I think that it starts with a very thorough assessment of everything from their health literacy to what their pharmacy needs are to what their physical needs are. And the hope, of course, is that they're going to live the longest and most healthy life that they can live. And I think that this whole health approach is certainly going to help that. One thing that I will say is that there's a saying in the VA, and I'm not even sure that I should say it, but if you know one VA, you know one VA. So you would think that, I'm up the street here in Jamaica Plain, you would think that our model of care is going to be the same as VA Connecticut, is going to be the same as VA Phoenix, is going to be the same as the VA in California. Unfortunately, it's not that easy. A lot of things are piloted, and they may be successful, and of course they have lots of funding and lots of resources available to pilot it, and then they say, okay, it worked, and it gets rolled out. And I've certainly seen that in the 20 years that I've over 20 years that I've been with the VA, is that a new initiative comes along, and it's kind of like Mark was talking about whether or not there's going to be good leadership to keep it going, because it's not going to be necessarily the same at every VA. I think in the last 5 years, the VA has gotten much better, especially with the PACT model of care, which is, as I said earlier, the patient-aligned care team, that the people that are on those teams is the same for the most part at every VA, and there is a similar model of care. The health span of a veteran, though, is what trumps all of that, because whether they're coming in for primary care or whether they're coming in for specialty cardiology care or whether they are a community care veteran, the VA doesn't have all services. For example, transplant was mentioned, and we're doing transplants for veterans on Longwood Avenue at some of the premier hospitals in the world, but the pre and post care is being done at the VA. So that's one example that I would say, is that even if it's something the VA can't offer, we're finding out where it can be offered. And then obviously there are lots of numbers and studies and guidelines and things. Every time that there's a new best practice that comes out, which is true for all patients, not just VA patients, the VA is incorporating that so that health span is certainly lengthened and certainly is the premier driver, because we don't want to just solve one problem. The whole point of whole health is to engage veterans and to engage the healthcare team to address everything. Things that may not be known right now. For example, our cancer chemotherapy clinics. A patient may start therapy and it seems like one thing and then it turns out to be something else. They're not just going to be turned away. It's not something that is going to be, their care continues. Does that answer kind of what you're getting at?
Does anybody else want to add? Go ahead.
I'll add one thing.
I think there's... There we go.
Oh, it's on. Okay. So I think two things. One, I think the VA also has a lot of these other services that can really make remarkable changes in veterans' lives. I'll share one example. Pharmacists in that patient-aligned care team in primary care have 1 hour-long visits available for patients for medication reconciliation. You're not going to find that in any other healthcare system. So a veteran sometimes will bring in a suitcase full of medications. The pharmacist goes over every single one, creates a plan. You'll find medications somebody's taking that were expired from years ago. They didn't realize they weren't supposed to take it. There was a veteran I encountered who really wasn't doing well because of this polypharmacy. He brought in his suitcase, we went through everything, and I noticed these drawings on his bottles, and the bottles were very old and dirty, to be honest. He had been reusing the bottles because the picture he had drawn on the bottle indicated to him what it was for. And what we discovered was that he actually was illiterate. So he couldn't read any of his bottles, and he was taking them as best he could. And what the VA had to offer this gentleman was, for blind veterans, the pharmacy department has a reader. There are special stickers that will print onto this bottle. You swipe it over a reader, and it tells you when to take it, how many refills, where to call, what it's for. And I will tell you, this man became so much more vibrant during the time that I cared for him, just from that one thing. If I had discovered this outside the VA, there never would have been a creative solution like that. And so that's just one very small example that I have to share. And I'll second that by saying, I'm sure everyone here who is a vet or has worked in the VA, everybody says hello. When you enter the VA, they used to call me Miss Smiley because I was always smiling when I walked in the morning. Hey, Miss Smiley. And there's community at the VA. I mean, I'm sure everyone who's been to or worked at a VA can say that people come just to hang out in the lobby, right? There's like coffee tables. There are veterans coming in who hang around the whole day after their doctor's appointment because their neighbor Jimmy is coming in and they're going to catch the same bus home. So I think that's another really special thing about the VA, is that they have all of these group classes, community programs, the MOVE program, which is like a big weight loss that's part of Whole Health that's been around forever. And it's, you know, any study of centenarians is something I find very interesting. People live to over 100. What they say is it's community. It's having those bonds with the community, and that's something that the VA really fosters. And you know, you'll walk through the hall. You know, it's not so formal. They say, "Hey, Dr. Susie," or "Hey, Dr. Brian," or whoever. You know, the veteran sees you. They're excited to see their doc. So not just amongst the vets, but I think amongst the care provider and the patient, it's very community driven, and I think that keeps people living longer.
Thank you.
No, you're fine. Definitely agree with that. In my experience treating patients in a cardiopulmonary rehab setting, it's a group setting. And you're going to have 70, 80-year-old veterans next to my 30-year-old veterans with cardiomyopathies from having COVID or a heart attack. And it's always interesting to me, the community that they develop in these programs, and it doesn't matter what your age is, you're a veteran, and they find that common connection to where they go out to breakfast after cardiopulmonary rehab, and then they bring us some coffee. But they go out to breakfast together, and they are always doing things for each other. A patient offered to fix the brakes on my car. I politely declined, but I think that's a big part, is getting these patients enrolled in the VA early and having them get the sense of community, and that we as healthcare providers are there for them throughout this lifespan is something that, like others have mentioned, you can't find anywhere else and will not exist in an outside healthcare system.
Yeah, can I just comment real quick? Gene, it's a really good question, because really that's the essence of it. What's the difference between Mass General and Kaiser Permanente in the VA, really, when you get down to it? And one piece that's really important, we haven't talked about it, but I think it lines up, lines up with your question, is homelessness. So the VA, I was just in Philadelphia, that's one of my VA hospitals I coach, the different folks. I spent all day with the social workers, and I spent a lot of time in the ED, in the emergency department. And the ED guy's a great guy. He was just telling me, you know, and I walked in there, it was almost like a homeless shelter. A lot of these folks come in, they're homeless. And you're not going to care about your high blood pressure if you don't have a roof over your head. So they get shuffled into a social work system with the social work. If you want to be a social worker, the VA is a place to go, because you're going to be busy. But it's extremely rewarding, because there's avenues to get these people off the streets. So it really, again, Mass General, I did internship there in 1979. It's a tremendous hospital. I mean, world renowned, but you get a homeless person, that's not their job, that's not their mission, and I get it, but the VA, that is their mission. So again, you're not going to care about a diabetic foot if you're homeless, so they will take care of you. So I guess that's really the essence of the bigger picture of this lifespan. So great question.
Thank you. Oh, go ahead.
Just building off of what Mark said, it's just in the VA as a physical therapist, realizing that my subjective or my interview needs to include those questions about how's your housing, how's your sleep, what's the point of anything else in my evaluation if they don't have a home, or they are struggling financially or at home with family. So learning to get comfortable asking those questions, working in pain, getting the Columbia suicide risk scale, getting comfortable with asking those questions. So I think that probably focuses more on the health span for me.
Yeah, thank you so much. You mentioned so many social determinants of health, right? That we again, I think we've been doing a much better job preparing our students in recent years to talk about these things and realize how, it doesn't matter what medications you have to treat diabetes. If a patient doesn't have a refrigerator to store their insulin long term, if they're living on the street, they're not going to care about some of these things. And so being comfortable asking questions about whether, about social determinants of health is certainly something I think we're all doing in our curricula now that maybe we weren't doing 10, 20 years ago. Also sharing your stories about the community made me smile because I did a VA co-op when I was a student here, an outpatient clinic on Causeway Street, and I remember so many and I agree with you, Brian, there were mostly elderly people who were coming in and getting their medications filled, and you could tell that it was a community. And Vivek Murthy wrote this great book together that talks about the epidemic of loneliness in this country, and especially for men. And I can imagine for men who have served, who are stoic, finding community may be difficult unless there's that community place that they can come to and socialize, because loneliness leads to depression, leads to not taking care of yourself, not caring about your care overall and outcomes. And so I think all of these things that you've shared today are such great examples of how we should be approaching patient care. Any other questions from the audience? Okay, so Mark, you said, you didn't ask us this question, but so is there anything we didn't ask you today that you want to share about your experiences that we should, take away today? We have some students who may be listening to us or watching us on YouTube channel later. Any other things that I should have asked you today that I didn't?
Maybe let's start down the other end. Brian, let's hear some words of wisdom.
Final words of wisdom.
I remember in 2003 when I was finishing pharmacy school and talking about doing a pharmacy residency, it was tough to convince my family what a pharmacy residency was. And it was especially tough to convince my very stoic Irish Catholic grandmother that I was going to be going into the VA. Her exact words were, "The VA? Who wants to go to the VA and work in healthcare?" And at the time, she was, of course, used to the VA of the 1950s, which is much different than the VA of 2023. It's much different than the VA, actually, of 2003 when I started. I was thinking how rewarding it is to be working in a place where everything that you do is appreciated, it's not expected. People saying hello when they come in, it's not just the providers, it's not just the employees that work there, it's the patients as well. They come in, the walls are very thin between my office and the pharmacy waiting room, and there's somebody that's there every day. There's a television there, there's a vending machine there, and the coffee cart conveniently passes by before it gets to the lobby to start its service. And this one veteran is there every day, and I can hear him laughing through the wall. He has a very particular laugh. He's there every day because he is homeless, and he doesn't have that he has to leave the shelter in the morning and he has to go spend his time doing something. He's disabled, he can't work, so he comes to the VA and spends his day there, and I know he's there because literally over from my right earshot I can hear it. I would just say that if the one thing that I would want to get across is if you aren't familiar with VA healthcare, become familiar with VA healthcare, because it is a leading and kind of preeminent organization within the healthcare spectrum in the United States. You know, we have clinics all over the place. We talked a little bit earlier about the distance that some veterans need to get to a VA. I'm from way upstate New York, near the Canadian border, and there is no VA for 3 hours, which is in Syracuse or Albany, depending on where you're coming from at that very top part of New York State. But there are community-based outpatient clinics. There are certainly services. Maine is a great example because of the vast geography between where Maine starts and where Maine ends by the Canadian border, that there are people, there are pharmacists, there are physical therapists, there are doctors, there are nurses that will go to your home, you know, on a rotating basis because you aren't able to come in. And if that's not a service that a veteran qualifies for, then they have the community care aspect of things where you can go to a more local hospital. Even if it's just, you know, the VA up the street in Jamaica Plain doesn't offer service and you're going to be coming down to Longwood Avenue to Brigham and Women's or Dana-Farber or something, they make it easy. And so the VA of the 1950s is not the VA of 2023, and so I would just say become familiar with the VA. If you're not, if you have family members that are veterans and need health care and they've not kind of geared in to the VA, it would certainly be worth their while to do so. It's been a very rewarding 20 plus years for me. I can't think of wanting to work anyplace else. I've never thought of leaving. I've taken different jobs within the same VA, but I would never leave the healthcare setting that I'm in, just because I feel like we are constantly changing and evolving for the better. And we do have good leadership at my VA, certainly, where programs like the Whole Health Initiative there's good buy-in from both staff, but certainly from patients as well. Just on Thursday, my clinic wasn't open yesterday for Veterans Day, which is an odd thing that we work for the VA, but we're off on Veterans Day. On Thursday, I had to call a patient and give him his results. It's a telephone clinic. And so when I called him, I had to be very brief and very clear, because he was on his way to Tai Chi, and he couldn't miss the start of Tai Chi because he wouldn't get a spot in the room. So there's definitely buy-in from veterans, and I think it's just an amazing place. So that's my closing thought that I want to leave with.
Great. Go ahead.
I just feel like having been in the VA this long, I don't know, like Brian, I don't know where else I would go. I don't want to leave the VA ever. And I think working at the VA has made me a way better clinician, but also just a better person. You know, our veterans can appreciate you being a genuine person, but they can smell it off of you. They know, looking at you, that you're a genuine person and you really care, and they don't have time to waste either. And there's just something beautiful about having access to almost all of their information, or as much information as possible, to be able to be a good clinician. I can't see how I could be a PT anywhere else. Yeah.
Wonderful.
So I don't work in the VA anymore, but I would say my advice to younger individuals who might be getting started in the VA or even just doing a rotation, I think the thing I cherish the most about my experience there is ask the veteran about his or her life. And that goes for any patient that you're taking care of. Ask them about their story. How did they get to your door? The things that I've heard veterans tell me are stories that are my most cherished stories that I love to tell other people. You know, stories of World War II veterans, somebody who served with Elvis, my favorite one. You know, people who suffered great hardship but are sitting there in front of you smiling. They give you so much perspective. And when you close the door and you have a couple extra minutes and you ask them to tell you something about their life, they feel like you care. So, you know, I had a student leave a review for me once that said, I've never seen veterans or any patients so excited to go to the doctor than to come to visit Dr. Susie. And it's like, they did because they knew I cared, right? So like, showing a vet that you care, they will never leave you. Yeah, they will be, if you try to transfer them, they're going to find a way back, right? So they're not going anywhere. They're very loyal, right? And when you show them that same type of care and loyalty, they will show it back to you. And there's not that many other instances in this crazy world that we live in where you find that type of genuine human connection with somebody who you don't know on a personal level. So getting to know your veterans is an honor and a privilege.
Thank you.
That's great. I would add, and just piggybacking off of what you're saying now, is this idea of connection and compassion just being so important. And I'm really inspired by my fellow panelists who've worked in the VA and who have made those connections, and I'm sure really changed people's lives in such a meaningful way. And then the other thing that I would say I would like to see going forward is just a continued focus on removing those barriers that prevent people from accessing the health care that they need, whether it's, we know that mental health and physical health are so related and so connected. And so continuing to, it sounds like there's such great opportunities and supports for people who are veterans, and just making sure that as a community and as a society that we are supporting these folks, and whether it's in places of employment or, again, just sort of out in the community, that those people, that we can continue to remove those barriers that are preventing people maybe from accessing the support that they need in certain cases.
Okay. I think, being a newer clinician, I really jumped into the VA from the start. And honestly, when I got the email about my clinical placement being in the VA, I was like, the VA? What? And everyone said, oh, no, you're going to love it. And they were right. So I think encouraging people that maybe express this interest in treating veterans or an interest in treating patients with this whole health model, encouraging them to go to the VA and really experience it. And the advice that I was given when I started residency was, as you develop this residency, this is what you make of it, so take every single opportunity while you're here. Get to know your patients. If there's something you want to see, ask for it. We'll set it up for you. And I think that's a really important thing as a newer clinician, is to really try to get as much hands-on and as much experience as possible, because that allowed me to learn more. And, as others have said, being in the VA has definitely made me a better clinician, even this soon out of school, and things that I think about every single day about my patients and what I want to do for them. Something as simple as getting them a walker. To tell patients, oh, I got that. Let me just get that for you. It lights up their face. Like, oh, it's something that I don't have to worry about. And there's one less thing is really, really important, and allows them to really focus more on their own health. So I guess my final words of wisdom are, as others have said, and just echo, is continue doing the best that we can for our veterans and encouraging people to go to the VA and really experience and get the care that they need.
Wonderful.
Well, I just want to thank you for putting this together. This is wonderful. On behalf of all of us, just thank you for taking some time out on a Saturday to talk about veterans care. It's a beautiful thing. 10 years ago, that probably wouldn't have happened, maybe even 5 years ago, I'm thinking, but it's going in the right direction, and the work you guys are doing at the deck plates, as we say, is tremendous, so thank you. Just two thoughts. One, again, every time I get a chance to talk about in front of a group of leaders, I just have to say this. The word care was used so much. I wish we could keep track how many times. So for the staff of Northeastern, at the end of the day, the students that feel very cared for will do better. You never know with the interaction you have with a student. If they say, hey, on a Friday afternoon, professor, you got a second? You have no idea that they could send them on a trajectory that you can't even dream about. And that just takes time and ability to listen to the students. So you do a tremendous job. Northeastern has always been a forefront of taking care of the students, but as much as we take care of the veteran, for the folks out there, Northeastern staff, taking care of your student or your students is really a game changer and a beautiful thing. And for the students, I guess the message I would have is I don't want to. I'll just tell you my story. So I real quick, I came out of Northeastern in 1980, took a job in a drugstore, and I worked there 3 years in Washington, D.C., and the pharmacist who was next to me was, now I'd consider him young, but he was old at the time, was 50, and he was miserable. And I'm thinking, man, this guy's pretty miserable, and he doesn't like his job, and I really don't particularly like my job. And it took me 3 years to kind of figure out I want to do something different, and I ended up exploring the different services, and I went into the Navy Hospital in Bremerton, or Bethesda, Maryland, and the person said, if you want to be something bigger than yourself, you want to join the Navy. And I didn't really know what that meant, but it just resonated with me, and that was my opportunity to do something different in my life. And that was, something I didn't plan on doing. And I guess what I'm saying to folks is, if you're not happy in your job, you don't want to when you get to the end of your career, you don't want to say, I lived a life of mediocrity and misery. The pharmacy and PT and all these different beautiful, wonderful opportunities that you have, if you're doing something you're not really enjoying, my goodness, be bold and go in a different direction. Try something else. There's so many different professions out there, and not professions, just job opportunities. But you don't want to live a life of mediocrity and misery. And you've gone to school, you're going to get a degree, and there's all kinds of doors that can open up for you, and you just run your own race. You don't have to do what everyone else has done. And the last thing I'll just say on Veterans Day is consider joining the military. It is a beautiful thing. It's a wonderful life. And Glenn, thank you for your service in the Army. All right, well that's it for me. Thank you, Marguerite. I appreciate it.
Thank you, Mark. So one of the things that makes me sort of reflective and warm and fuzzy here is I absolutely love my job. I've been here for 23 years as a faculty member, and I practiced for about 15 of them at Beth Israel Deaconess Medical Center. And I stepped away from practicing because I took a leadership role and I couldn't practice anymore. And one of the reasons why I made that decision to step away from practice are some of our alumni who do the kind of work that you all do. I had a privilege of being in the classroom when Brian and Susie were our students, knowing that I had some impact on their educational journey here and the kind of work that they do and the kind of care that they provide. And I'm sure those of us here who taught, physical therapy students here probably feel the same feeling of pride, but also awe for how much impact you're making on patient lives every day and how passionate you are about your work. And I think I'm so glad that we did this, and I'm so glad that this is videotaped, because I often am very worried about the future of the workforce. We are having shortages in the workforce across many of our professions. We have a problem with representation in our workforce, and I think we need to inspire the future generation of high school graduates and undergraduate graduates to go and pursue these wonderful, fulfilling careers that, as you said, don't allow you to live the life of mediocrity, that really allow you to have so many different opportunities, even if you end up being a pharmacist or a physical therapist and you don't like what you do at the moment. There's so many different opportunities out there for you to make a difference in patient lives. And train other students. And I know many of you are preceptors and have been faculty and work with our programs in various ways. And I want to really thank you on behalf of everybody here for your time today, and just for your service and for your passion and for how you engage with us at Northeastern. Thank you. I'll let you come up, because I think they're streaming this and they won't hear you.
I just wanted to thank you just wanted to thank you, Margarita, for putting this program together and inviting the alumni, and your experiences and your passion and compassion is really amazing. It's really, for me, it makes my day, every single day, worthwhile, and it's a privilege and an honor to be here today. Thank you, and thank you, everybody. Have a good day.
Okay, if you all can just stay here so we can take a